Hi, welcome to our joint replacement preoperative education class. We appreciate you taking the time to listen to our presentation, and we hope that you find it helpful. We divided the class into modules that you can watch at your own pace and go back and listen again to any part you need to review. You will be hearing from several members of our team during the course of the presentation, and keep in mind that those patients that take the time to prepare for surgery have a much smoother recovery process. Thank you for choosing LifeBridge Health. We know you have choices to make, and we appreciate you placing your trust and confidence in us. So what are our goals for the class? We want you definitely to feel prepared for your surgery, but it's also important to understand your role that you play in your successful recovery. The focus of the class will be on providing you with information to help you have the best possible outcome after surgery. And also at the end of the class, if you have further questions, we'll encourage you to call your surgeon's office and they can direct you to the appropriate person to help. So what made you ready for surgery? When you came into your surgeon's office, you were probably told that you have little or no cartilage left and you're now experiencing bone-on-bone pain. So by making a decision to get your joint replaced, you're taking the first step to fix this problem. During the surgery, the surgeon will go in and put in a device or prosthesis to create a nice smooth surface going forward. But just remember that even though you'll have a nice new joint and can look forward to decreased pain and much greater mobility, you still need to get through that surgery and recovery period. So what's the next step? Once you have scheduled a date with your surgery scheduler, you will be asked to make several appointments. You'll be asked to contact your primary care doctor and any specialists you see, such as a cardiologist or a pulmonologist. All of these doctors will need to say that you are cleared for surgery. The appointment with your primary care doctor needs to be within 30 days of your surgery, and the results need to be faxed back to the office 2 weeks before surgery. So do not delay in making this appointment. If you do not have a primary care doctor, please let your surgery scheduler know. They may be able to schedule you a pre-op exam through our pre-anesthesia screening service or PASS office. Another thing to consider is to take care of any ongoing dental issues you may have. You do not want to go into a joint replacement surgery with any source of possible infection. So what can I do before surgery to get ready? There are lots of things that you can do before surgery to get ready. One of the most important things is to figure out who you're going to have available to you to give you some help. You're going to be able to function after surgery. You're going to be able to do a lot for yourself. You'll be able to bear weight. They will teach you to do stairs. But you're also going to be fatigued after surgery. You're going to be tired, and you may need some help with doing actual daily living tasks. So right now, I would encourage you to think about who is going to be your coach, your support team. It could be a spouse, a family member, friend, church member, anyone that you could count on to do some errands for you or come and give you some basic assistance. Some other things that you should think about planning to do would be to making some meals ahead of time and putting them in the freezer, stocking your pantry, getting your laundry done, and also making sure that there are no tripping hazards in your home, so removing your scatter rugs and cords. If you have a pet, you also need to be thinking about, will you need any help with their care afterwards, such as walking the dog or cleaning the litter box. Anything you can do ahead of time to prepare or plan for your surgery will certainly make your life easier afterwards. What should you bring to the hospital? A lot of patients worry about what to pack, but really, in reality, you don't need a lot. You want to remember to make sure you bring your identification, your prescription cards, your insurance cards. You're free to bring your cell phone with you, but please leave other valuables at home. You'll be asked to wear clean, loose, comfortable fitting clothes and shoes with the closed back and rubber soles. We want you to be comfortable, and we also want to prevent falls. You will be able to wear those same clothes when you leave the hospital. Are there any special instructions before surgery? One of the more important ones is what medicines to stop before surgery. It would be best to discuss this topic with your primary care doctor at your pre-op appointment. Basically, you will be told to stop anti-inflammatory medications, herbal supplements, and vitamins about 1 week before your surgery. You're asked to stop these medications because they might thin your blood too much for surgery. Our pre-op nurses will give you instructions for the medicines to take the actual day of surgery. Other instructions before surgery will involve cleansing your skin to prevent surgical site infections. So you may be asked to use some antibacterial soap before surgery, or you may be given some cloths to use to wipe down your skin before surgery. If you go to our PASS appointment, you will be given some sage cloths, which contain the ingredient chlorhexidine gluconate. You will be given instructions how to use them. And basically, you will be told to take a shower the night before your surgery, wait 2 hours for the pores in your skin to close, and then to open the package and use the 6 wet wipes to wipe your skin down with. You will also be told not to shower the morning of surgery because that would wash off the skin prep that you used the night before. If you do not go to our PASS office before surgery, please do not worry. Your surgeon would recommend that you use an antibacterial soap for a few days before your surgery, and then rest assured that you will be given a package of the sage cloths to use in the pre-op area when you come to the hospital. Remember to put clean sheets on your bed the night before surgery and avoid letting pets sleep in the bed with you because they carry a lot of germs. One of the more important instructions you will have is no eating after midnight. But also remember not to use any gum, mints, or candy in your mouth the morning of surgery. However, we do encourage you to brush your teeth and use mouthwash. Good hygiene is always important. So where do I go and what time do I arrive for surgery? Keep in mind that a lot of the surgeons do not finalize their surgery schedule until very close to the surgery date. So though it's very hard on you, some of you will not know the actual time of your arrival until very close to your surgery. You usually get a phone call the day before or on Friday afternoon if your surgery's on Monday. The range of arrival times is anywhere from about 5:30 in the morning to about 11 a.m. It's very important to be on time, so plan for your transportation needs ahead of time and plan to be flexible. When you arrive in the hospital, you will go to the main hospital lobby and then on to patient registration. After being registered, the staff will direct you to the 4th floor OR waiting area. You're usually allowed to bring one person with you. The check-in area is next to the pre-op waiting area. This is where you'll be waiting when you first arrive before they call you back to the pre-op area. If someone comes with you, this is where they can wait during the surgery. They could also choose the lobby or the atrium area. You will be asked to leave your family member or friend's contact information at that check-in area desk. Usually the surgeon comes out after the procedure and gives a report in person, but just in case they miss your person, they will have a phone number to contact them for a report. What happens in the pre-op area? You will be called back to the pre-op area about an hour and a half before your surgery. There you will meet members of your team, your nurse, your tech, and your anesthesiologist. To get ready, they will hand you a set of those sage antibacterial cloths to wipe down your skin before you get into your hospital gown. The nurse will also hand you a vial with some medicine in the bottom and a Q-tip, and they will teach you how to swab your nose. These measures are done to help reduce infections. The nurse will start an IV and will give you some pre-op medications. They may also ask you to sign some consents for surgery and for anesthesia. The surgeon will come through and confirm the site of the procedure by signing their initials. What about anesthesia? When the anesthesiologist comes to talk to you the morning of surgery, they will be reviewing your medical history with you and presenting to you your anesthesia options, which are general anesthesia or spinal anesthesia with IV sedation or twilight. Keep in mind that most joint replacements are done with spinal anesthesia. The anesthesiologist will ask you about any previous anesthesia experiences and give you an opportunity to ask questions. Rest assured that the anesthesiologist will guide you towards the best option for you. During the surgery, the surgeons can provide various blocks to numb the surgical area, which can provide great pain relief. All right, what should you expect in the OR? First of all, when you enter the OR, it's a very cold environment to reduce germs, but they will have warming blankets available to keep you comfortable. Most of the surgeries take about 2 to 3 hours from start to finish. You will be given IV antibiotics during the surgery, again as a prevention measure, and afterwards you will be taken to the post-anesthesia care unit to recover. What happens in the recovery room? When you wake up in the post-anesthesia care unit, you will be closely monitored. The nurse will be taking your vital signs, checking your temperature, your blood pressure, your oxygenation levels. They will be managing and monitoring your pain as well. If you have spinal anesthesia, they will be waiting for the numbing to wear off so you can get up and begin to walk. So be aware that you will be in the recovery room for quite a while, for several hours, before they feel that you are ready to go home. They may offer you something light to eat, like crackers or ginger ales, to help minimize any possible nausea. And when the nurse feels that you're awake and alert enough to begin your physical therapy evaluation, they will help you to get dressed and have you sit up in a reclining chair. The therapist will come to the recovery room to make sure that you are safe to go home. They will provide you with education and training and make recommendations to you. You will be provided with a walker if you do not have one, and you will also be given ice packs to take home with you. What should I expect when going home? You will definitely need someone to stay with you overnight. It would be preferable to have someone stay with you for the first few days and to have someone available to you for the first week or two. While you will not be restricted on doing stairs when you go home, some patients prefer to stay on one level at first, or possibly make just one trip a day to go upstairs at night to sleep in your own bed, get washed up in the morning, and then go back downstairs. Remember, you are not sick, you're well, you have a brand new joint. We encourage you and want you to get back to your normal life as soon as possible.